Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Joan Buckley from the Nursing Department here at Nassau Community College. Today I want you to learn more from doctors that provide help when they aren't even in the same room. It's called Telehealth, and it has a huge role in providing access to health care for underserved populations. Our guest today is Dr. Shelley Cooper, who is the CEO and founder of a company called Diversity Telehealth, and their expertise is in telemedicine and remote patient monitoring. So Dr. Cooper, welcome to Your Family's Health. This is the voice of Nassau Community College, 90.3 WHPC. So, Dr. Cooper, can you tell us a little bit about yourself and how you came to be the CEO and founder of this company, Diversity Telehealth?
Well, sure, Joan. Thank you. And thank you, too, for allowing me to share my information with your audience today. Just a little bit about me. I've had Diversity Telehealth has been my company for the last 5 years. We're located in the greater Kansas City area. What telehealth is and what it does has definitely been a passion for me because it helps to close the healthcare disparity gap among the haves and then the have-nots. The way I got into this market was through the back door, let's say. I was a corporate baby, actually someone who was in the corporate arena for 10 years and didn't really see that I was making a difference in the lives of the people who really needed to be helped. And so I became a classroom teacher, a computer applications teacher for 25 years. And during that 25 years, I noticed there was an increasing number of students who needed health care, who were absent from the classroom for sometimes weeks at a time. And I wondered if there's some way that I could help them to remain in the classroom, to get the education they needed, to allow their parents to go to work without having to miss days at work and possibly lose their jobs. And so during the last 5 years of my time in education, I went for my doctorate. And my doctorate is actually in instructional technology and distance education. And what that entails is providing a service from a distance. And during our rotations, we explored providing law from a distance, food from a distance, and then healthcare from a distance. And I thought, okay, this is great. I'm still helping people. I'm not a clinician, but I am a doctor of education. Mm-hmm. And so in finding what needed to be done in the field of healthcare and blending that with education, I saw that I could use technology, which is what I've been teaching for the last 25 years, using technology to bring healthcare to people where they are and to help to close that healthcare disparity gap that I mentioned earlier. There are two words, telemedicine and telehealth. Is there a difference between telemedicine and telehealth? I'm so glad you asked that because a lot of people use them interchangeably, and actually they're two completely different terms. They're related, but they're not the same. Telehealth is, if you can imagine an umbrella, telehealth has several parts to it. So telehealth is a delivery of healthcare and healthcare-related education using technology. So one of those legs, let's say, of telehealth is telemedicine. And telemedicine is delivery of the health care by the clinician to the patient, where the patient and the clinician are in two different locations. They're connected using HIPAA-compliant, military-grade encrypted software and networks, and health care actually takes place. Another one of those legs is education portion. So the physician can receive education from a university. The physician can discover information about the patient from another physician. The patient can receive healthcare-related education, say, in the field of diabetes or asthma or some other chronic disease that needs to be managed on a regular basis. but it allows the patient to receive that information without having to leave their home. Another part of the telehealth umbrella is remote patient monitoring, and that's when devices are located in the patient's home. They're connected to the clinician or some type of nurse monitoring area, and those healthcare providers are able to monitor the health of the patient without the patient leaving their home. So it's great for homebound patients. It's great for people who are perhaps have difficulty leaving their home, like those who are suffering from COPD or other respiratory illnesses. Mm-hmm. It's also good for those with mental illness, because for those who are not comfortable leaving their home, or their treatment plan is composed of certain parts that encourage them to remain in a certain environment, it allows them to stay in their home or that particular environment without leaving their home, but actually receiving the care that they need.
Now, what kind of equipment is needed in the home of the recipient of either the telemedicine, telehealth, wherever the connection is? What kind of equipment is needed? Is it very expensive? Is it supplied by insurance? How does that work?
Well, there's lots of different pieces of equipment that can be used. It can be something as simple as, we call it a POT, a plain old telephone. Mm-hmm. So years and years ago, telemedicine or telehealth was actually part of the treatment plan for several other people. You could possibly call your doctor from your home phone, your landline, and the doctor would prescribe meds or prescribe a treatment plan, and that would take place without leaving your home. So actually several people have used telehealth without being aware of it.
Right.
And also several others have used telehealth without being aware when they go to a facility and they receive an X-ray. So the X-ray is normally read by a technician located somewhere else in the world, and then that information is relayed back to the regular physician. But back to your question, there are several pieces of equipment that could be used in a telehealth encounter or telemedicine visit, but sometimes that equipment is as basic as software. So especially for mental health visits, software on your phone or on your laptop or your tablet can easily be used to transmit the voice data to the healthcare provider. But in some instances, it's required for heart sounds, lung sounds, visuals of using a dermatologist camera, digital stethoscope, a digital otoscope to look into nasal passages and other airways. So it's really important to realize that equipment shouldn't keep someone from using telehealth. There are lots of different ways that we can scale down the equipment so it's affordable and in some cases reimbursable from insurance.
Wow. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the Nursing Department here at Nassau Community College, and today we're talking to Dr. Shelley Cooper, who is CEO and founder of Diversity Telehealth, and we're going to continue talking about this, and this remote patient monitoring is amazing. I mean, sometimes I feel like my family send me pictures and my cell phone looks like a patient file, because it makes sense. When you reach out to someone, do you always need to be right there to give them advice or the next step that they need to take for some reason? Now, is telehealth, is it always an ongoing assessment, or could it be like episodic, like someone doesn't feel well? Like, does Diversity Telehealth have that capacity as well? It's almost like an emergency line.
Well, Diversity Telehealth actually has 3 areas, and one of those areas does provide a remote type of healthcare service. And with that, we're powered from Teladoc, and Teladoc is a nationwide service with more than 25 million subscribers. So with just backing up just a second, Diversity Telehealth's goal is to provide health care to underserved populations nationwide. Mm-hmm. So when we decided to do that, we took on Teladoc's service and reduced the price to between $11.99 and $19.99 per family per month.
Wow.
So that families can have access to health care providers, board-certified physicians, that they can have unlimited number of health care visits for their family and their loved ones located in the same home or same family. Now, the reason I mention that is there are so many chronic diseases that if the patients had access to a doctor just to ask basic questions, I'm feeling lightheaded, I have this rash, I have difficulty breathing, my eyes are a certain color, I don't understand what it is, my nails seem to be more fragile than normal. There's so many things, questions that can be asked of physicians that could possibly prompt them to take action or to create a treatment plan for that patient that could be life-saving. My father passed away just over a year ago in his sleep, and when the coroner performed the autopsy, he mentioned he was just dehydrated and a little anemic, but he'd grown so weak that he didn't go to the doctor. He wanted to wait until his next visit. And with a lot of our seniors, they're unlimited income. They don't want to bother their adult children. They may not have transportation to get to a doctor, but they really need a doctor's care. So with those types of scenarios, it's really important to have access to health care at the palm of your hand. They may not feel comfortable using a smartphone, but like I said, they can use a plain old telephone, landline, call in and give them their blood pressure, or maybe they have retained a lot of water, and that is another symptom for another type of remedy. So the main idea to keep in mind is having that access to the doctor on your cell phone, on your plain old telephone, on your computer, on your tablet can save your life. It can save your loved one's lives, and it can be done with a very minimal cost.
You know, when I was coming up as a nurse, working and stuff, I remember one physician said to me, you never have to touch a patient if you ask the right question. And I think that with telehealth, people have to be comfortable knowing that the way medicine, nursing, we're educated is questions. What questions we ask often give us an idea of what's going on. And we can suggest, right? I'm a nurse practitioner as well. So obviously, if you tell me, like your dad, you said he was dehydrated, if you had known, you could have asked questions. If he had telehealth, they might have said, well, how much are you urinating, or how much are you drinking, or things like that.
Exactly.
But
exactly.
You're absolutely right about the senior population. I love the idea that it is so cost-friendly for a whole family. That is huge, because I don't think I've ever heard anything under $15 a month. I don't think I have any bills, and I don't know of anyone that, if you had to come up with what it was, 11 something a month for a family to have this service. Because even with children, like you talked about the seniors, but even with kids raising
That's
children,
right.
The questions, I mean, you must have, what kind of questions do you get? You must get all sorts of, I don't know, it's huge. The whole, what you're making available to people, I think, is amazing.
Well, and I appreciate you acknowledging that there is a need for this. And I think a lot of times, and I'm here, like I said, in Kansas City, Missouri, and the service is available nationwide. There are only a few states, I think it's Utah and Vermont, because of their state mandates, for some reason aren't open to some of the products that Diversity Telehealth offers. But here in Kansas City, we're on the state line between Kansas City, Missouri, and Kansas City, Kansas. Initially, Kansas would not allow this service to be offered. So I was determined, and I petitioned the Attorney General of the state of Kansas and paid a $50,000 bond to allow Diversity Telehealth to offer telehealth services in the state of Kansas using TeleDoc. And what's important is when they buy this service, they also receive a discount card for vision checkups, a discount card for pharmacy, and also a discount card for dental. So even if they're not able to get into the doctor's office, they can still see a dentist, and they can still get their eyes checked. And yes, a lot of these services are available through free health clinics But sometimes you might need to go on a Saturday, or you might need to go in an evening, or you might need to talk to a doctor when you're not able to get into the clinic or other location. Yeah. So I think we need to open our eyes to other options of providing that health care. And as usual, the lower the income, the less likely the patient is to have access to health care, and the more likely they are to suffer from several of the more serious chronic diseases that decrease the lifespan. They shorten the lifespan. And so the goal of Diversity Telehealth is to make sure that the healthcare disparity gap is closed as much as possible, and that is my life goal from here on out. This is what I've been doing, and I speak at churches, at community centers, trade shows. I hand out flyers. I hand out business cards. I have a banner that has my face on it. And
oh my gosh!
Say, I see you, and I was like, okay, I feel like I'm a stalker here. I don't want to be.
Listen, I want to talk about you stalking, but let's take a quick break, okay? My name is Joan Buckley from the nursing department here at Nassau Community College, and today we're talking to Dr. Shelley Cooper, who is CEO, founder of a company called Diversity Telehealth, and she doesn't stalk, but she does push for shortening that gap between who gets healthcare, when they get it. And you're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Hi, I am Dr. Ilan Shapiro with today's tip for kids from the American Academy of Pediatrics. Allergic reactions can be unpredictable. If your child has severe allergies, make sure people at school or childcare know what to do. The plan should include how to recognize anaphylaxis and how to give life-saving epinephrine. For more information, talk with your pediatrician or visit healthychildren.org, where you can find an allergy plan you can customize.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thanks for being with us today. My name's Joan Buckley from the nursing department here at Nassau Community College, and we're talking to Dr. Shelley Cooper about diversity healthcare and diversity telehealth. And her expertise is education transformed into instructional design, and this telehealth just seemed to grow from something that started out as her passion. So, Dr. Cooper, tell us, how much pushback? I'm always interested in who said, no, this isn't going to work. I'm always interested when someone's trying something so smart. Who's going to say, oh, that's not so smart? Do people really think that you need to be in front of a doctor, or have you got documentation and feedback that says this is life-saving?
Well, I actually do have documentation and feedback, and that was actually what helped me during my dissertation process. But I think what's happened is, over the last 4 to 5 years, when I first started this company, I received a lot of pushback. Well, how can you possibly have a doctor's appointment and you don't go to the doctor? And I was at my dentist once, and I mentioned it to him, and he laughed that how could someone actually have a dentist appointment without sitting in a dentist's chair? Well, when we think about it, when we're having some type of episode, we're having stomach pain, or we're having a head pain, or there's something going on with us, and we call in and we describe our pain to our doctor, or we describe what's going on to our dentist. There are several ways that, and of course you being a clinician would know, once you ask those questions, you narrow down the focus of what the problem might be. Oftentimes when people visit a doctor, there's no touch on touch. It's all questions. And so I think in the early days, it was difficult for people to understand that a lot of healthcare is just what you said, asking questions, and with those questions you get certain answers, and it leads you toward the right path. Now, I'm not saying that if someone's having chest pains, or they're bleeding, or they have a potential broken bone, that telehealth is the answer for them. There are definitely circumstances that require the patient to seek face-to-face medical care, but there are oftentimes situations where that isn't necessarily required. For example, poison ivy. My husband was gardening, and poison ivy emits some type of oil, and that oil has a highly allergic reaction to. So he was perspiring, he wiped his face with his shirt, and his face just blew up like a balloon. So what we were able to do was use our plain old telephone, call in our Diversity Telehealth account, and we were able to connect to a doctor within 2 minutes. He asked all of those questions that he would have asked if my husband had driven to the doctor's office. He sent a script to the pharmacy. He gave us a treatment plan. It all took place in less than 15 minutes. So the remedy is there. It's not there for everything. It's not an end-all, be-all, but it is a support, especially for those who have difficulty getting to a doctor's office or have difficulty, say those who are on the autism spectrum, and just going to the doctor might cause another episode or discomfort. Being able to have some of those visits from the home location or the school location could really make it easier for those people who are suffering.
I just have a question. If I was to be looking to become, have this service, would my whole family have to come in person? Like, how is it orchestrated? Is it through a dialogue over the phone where you give the history and physical, not the physical, but you give the history of each family member? Like, how is it orchestrated? How do they put it together where they're confident enough that if I call in and I'm talking about, Joan Jr. and you just, that kind of thing, like, how does it start?
Well, actually, normally it can be done online. So the customer would go to diversity.phecard.com, and on that website, there is a button that says click here for service. And when they click there, they choose either the $11.99 or the $19.99 package. The $19.99 package includes, of course, more services and more options. But once you go in and you enter your name and your birth date, your email address, and no Social Security number is required. So I think that's really good for those people who might have some concerns about it. There's no Social Security number needed. And once you go in and you give your children's names, your spouse's name, or your partner, they don't need to be married. It's also partners can be on that plan. You go in and you sign up for the service. And then you receive a book that gives you a list of providers within a 5-mile radius of your zip code. And then you do what's called My Portal. You go into My Portal and you do just as you mentioned. You put in your allergies, your medications, your illnesses that you suffer from. And if you have a primary care physician, you would list that name as well. So when you actually call in and need the service, or you activate the app on your phone, and that primary care physician or board certified physician or whomever happens to take your encounter request has an electronic health record of your physical service, you and all of your family members. So that physician wouldn't prescribe something that you've listed as an allergic reaction. They would know already what your types of physical conditions might be. So it gives a health history. It's an abbreviated health history, but it is a health history that provides a better scenario for that physician, so that medical encounter can be more inclusive and also be a better help when you're in a situation where you need to talk to a doctor who's not your normal primary care physician.
Wow.
And then as a result of that, at the end of that encounter, they will ask you, would you like this information to be forwarded to your primary care physician? So the next time you go into the doctor will say, oh, okay, on this date, we see that you contacted, through Diversity Telehealth, you contacted a physician, and you had this encounter, and you were suffering from, say, poison ivy allergic reaction. And I see that you were prescribed a steroid and also some type of analgesic cream. So how did that work for you? Are you still suffering from that? So it actually allows the patient to be more in control of their own health. It also allows the doctor to have a better idea of what's going on with their patient when they're not in the doctor's office, and it allows that to happen for a very minimal cost for everyone in the family.
Wow. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the Nursing Department here at Nassau Community College, and we're speaking with Dr. Shelley Cooper, who is CEO and founder of Diversity Telehealth. Sorry about that. But you know what you mentioned, again, and it just is so true. It's one more option. And if someone had... if you had a lot of children, and people don't all have cars, and I think that's something that, depending on where you live, you assume, like on Long Island, we have a lot of cars, and we have buses, but that's not the way, and it doesn't mean everybody has a car, and it doesn't mean everyone can afford a bus, but to have this available, and like you said, and to be absorbed sometimes by the healthcare system itself, right? In different situations, it's allowed in clinics. It's allowed for certain people to have access to it, so people don't have to not try it. It just seems like such a win-win. Like, why wouldn't you have this service if you really had trouble accessing healthcare?
I agree, and you know the good thing about it too that I often tell people who have insurance, they have the best insurance they could possibly have. They say, well, we don't need that. Well, that's great. And we have a primary care physician. Well, that's even better. But what do you do when you live in Long Island, but you're visiting friends in Florida? Right, or you have to travel to California and something happens? You're going to end up either in the emergency room and have a huge copay and a huge bill, as well as your company having a claim that will go against their total that they're going to need to take care of at the end of the year, or you're going to end up in urgent care and pay a copay. With this, and you're not be able to contact your primary care physician, and they may or may not know about this certain situation that happened. So this connects all of those. It is a support for all of those types of situations. And what I found, too, when I mentioned earlier, as a classroom teacher, and I would see these students who had continual absenteeism fall farther and farther behind in their studies. Right. Their parents would possibly be reprimanded on their jobs for missing work. It just solves that situation, because 3 o'clock in the morning and you hear your child with that cough, and the first thing you think of is, I'm going to have to take off work tomorrow, or they're going to miss school again, or
they stay home by themselves.
All those things. That's right.
It's big. So listen, if our listening audience were to take away one really good message from you had a lot of good messages, but what would be the one thing you would want them to know, like how to contact telehealth? I think you gave the website before, but give it again. And what would you want them to take away from your passion for this company being so important for closing that gap in diversity in healthcare?
Well, the first thing, my website is diversity, DIVERSITY, P as in Paul, HECARD.com, diversity.phecard.com, and that is the website to sign up. One of the main things I would encourage, and this I think about this constantly, is please don't assume that going to the doctor 2 or 3 weeks from now, when it's a good time for you, is what's best for your health. If you can contact a doctor 24 hours a day and ask those questions that give you peace of mind, you don't want to take the chance that your loved one or that your child or someone else waiting for health care ends up with a tragic result. I'm not trying to be a pessimist. I'm just being a realist. There are so many of us who don't go to the doctor when we should, and we put it off, and we could just ask basic questions that could possibly save our lives. So for the cost of a pizza, depending on where you live, here in Kansas City, you get a pizza for $12. I don't know.
You're absolutely right. No. Yeah, you're right.
For the cost of a pizza, you can make sure that your family has access to health care 24 hours a day.
Okay, I want to thank you, Dr. Shelley Cooper, for being here today with us. This is Joan Buckley from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.